I'm Dr. Jumamil. I'm internal medicine and obesity medicine doctor, and I'm currently a resident at Mount Sinai in preventive medicine. I'm going to talk about respiratory health and obesity. It's definitely timely since it is peak flu, COVID, and RSV season. So I wanted to put this slide here just to go over long COVID, a syndrome of symptoms that people experience long after their COVID disease is over. So they were sick with COVID, but 3 months after, they're still having symptoms. And the common symptoms that people have are coughing or breathing problems that persist. People might have loss of smell or changes in their taste. People can have body aches, headaches, chest pain, or stomach pain, trouble sleeping, brain fog, and trouble concentrating, and general fatigue and mood changes. And Mount Sinai has a registry of folks with long COVID, and right now we know over 200 symptoms associated with long COVID. Something to note is that there is no test for long COVID. It really is that pattern of having had COVID and then symptoms persisting 3 months after that diagnosis. So there's a great link here on smartuniversity.org if you wanted more information on long COVID clinics and programs. Mount Sinai also has a long COVID clinic. There are some risk factors that make it more likely for someone to have long COVID, and that includes someone who didn't receive a COVID vaccine, someone who had a very severe COVID illness, especially for those who were hospitalized, and those who had underlying health conditions. And obesity is one of the health conditions associated with this. We wanted to put some information here to make sure that you're up to date on vaccines. There is a booster available for COVID, and it's eligible for anyone over 6 months old. If you're unvaccinated, then it's 2 doses of Moderna or 3 doses for Pfizer. We are in the middle of flu season. If you haven't had your flu shot, it's not too late. It's better to get it and to have some protection. We are seeing a rise in flu cases as well. RSV is another type of virus that causes respiratory illness and hospitalizations for elderly folk. It would be one shot if you're over 60. So it's not like the flu where it's an annual shot. So there's that. For pneumonia vaccine, if you're between the ages of 19 and 64 and you have a high risk condition, which includes pregnancy, HIV, cancer, diabetes, chronic heart, liver, lung disease, and kidney failure, and others, then you would be eligible for pneumonia vaccine. And we recommend the high dose pneumonia vaccine. We recommend pneumonia vaccine for everyone over 65 because that does place people at higher risk for hospitalization. I also wanted to just go over a trend in cases in New York. The New York Health Department has a website where they look at the trends of COVID data. And as you can see, there was a lull earlier, but there is now an increase in cases of COVID, and this is a per day. So in December 30th, for example, there were 268 cases of COVID. So that's much higher than, say, in middle of November when there was only 131 cases. Now there's almost double that. And if you look by subgroup, by age, you can see that for all ages, for everyone, there's on average 22 people per 100,000 that get COVID for all ages. But the people with the highest risk of getting COVID are those who are 75 and over. So in the week ending December, there was 42 cases per 100,000 people that got COVID, which is more than double what it is for all ages. And the next subgroup that is at higher risk are those from 65 to 74 and those from 0 to 4. So the people who are at higher risk of getting COVID are those who are older and those who are very young, ages 0 to 4. There's data that is climbing up, so more reason to keep yourself protected and considering getting the COVID booster or vaccine if you haven't. I wanted to talk about obesity, and it's more than just weight. The medical community is looking at it as a medical condition where excessive body fat is affecting one's health. And it is associated with many conditions such as heart disease, diabetes, stroke, some cancers. The CDC recognizes over 13 cancers, and it's also associated with over 200 diseases. So it is very much a factor in one's health. And it's measured imperfectly, I will say, but measured using the body mass index, which is calculated as weight in kilograms over height in meters squared. And a BMI of 30 or higher is considered obese. Now, this measurement isn't exact because it doesn't include body composition. If you're a bodybuilder, then you're going to have a high BMI because most of your body is composed of muscle, not fat. So it's not perfect in that sense, but that's what we use as a screening tool. What we realize is that obesity is very complex. And it is a multifactorial disease where genetics is a contributor. There are estimates that 30 to 50% of one's risk for obesity actually comes from their genetic. Overeating, of course, and lack of physical activity. And some medications are also known to lead to weight gain. And of course, mental health, food access, and other social determinants of health. Obesity affects over 42% of US adults and about 1 in 5 children. That prevalence is different according to where you are in the country. There are higher rates of obesity in the South and Southeast, but here in New York, it's also high around 30 to 35% in this graph. So how is obesity related to respiratory diseases? Well, for one, excess fat, particularly around the abdomen, can physically limit lung expansion, and it makes it harder to breathe deeply. And this restricts airflow, leading to reduced ability to get oxygen into the body and eliminate carbon dioxide, which affects our cells and can also affect our concentration and breathing. And the fat cells themselves also secrete inflammatory hormones that causes chronic inflammation in the lungs. And that chronic inflammation can lead to different things such as asthma. But in terms of the physical limitations, something you may have heard of is sleep apnea. So obstructive sleep apnea happens when there's extra fat mass around the neck, which can block airways during sleep. And this can cause snoring and pauses in breathing. So people with sleep apnea will often say, oh, my partner complains that I snore too much, or they wake up after sleeping 8 hours, but they don't feel very refreshed. Those are symptoms of sleep apnea where during the night you stop breathing and oxygen isn't getting to your brain. This condition is quite serious if it goes untreated for a long time because it can increase your risk for heart disease and stroke. And the treatment for sleep apnea is what we call a CPAP machine. And what it does is that it opens up your airways while you're sleeping. But of course, it's not really the most comfortable contraption. The true treatment would be getting rid of the excess mass around the neck, and that can be through weight loss. Asthma, as I mentioned, the fat cells can produce inflammatory hormones that can worsen asthma symptoms and make them more frequent and reduce responses to medication, which is unfortunate. And what happens with increased inflammatory substances, you get airway hyperreactivity, which causes your small airways in your lungs to become inflamed and constrict. And when you get that constriction, you can't take a deep breath. People will have more symptoms, more exacerbations, and when they take their pump medications like albuterol, it doesn't really work as well. So that can also decrease one's quality of life. So during the COVID pandemic, we saw that people with obesity were more likely to suffer severe complications because the virus can worsen respiratory issues such as asthma, such as sleep apnea, and the inflammation from excess weight can also make it harder for the body to fight infection. When you have a lot of inflammation, your immune system is down. So that's why it's harder to fight off COVID, but also other illnesses as well, such as other respiratory illnesses like the common cold, flu, things like that. So it's really really important to manage obesity, not just for respiratory health, but also for reducing the risk of other serious diseases like diabetes, high blood pressure, and cancer. And the way we do that is obviously diet changes is very important, but also easier said than done. The standard American diet is notorious for cheaper foods that are unhealthy, like convenience foods that are high in fat, sugar, salt, but trying to lean more towards whole foods, like real foods that are less processed, like vegetables, fruits, things like that, is preferable. Physical activity, of course, and other behavioral modifications. Medications, which has gotten a lot of attention in the media. Surgery and different devices like balloons and other things. Dietary changes, regular physical activity, behavioral therapies are all essential. But for many, these lifestyle changes alone are not enough to lead to significant or sustained weight loss. I know there's a lot of interest in medication, so I thought I would go over and try to make sense of what is being said in the media. So the newer medications that are out there are part of a class called GLP-1 agonists. And GLP-1 is a hormone that helps you regulate blood sugar, but also has a significant effect on appetite regulation and weight loss. So GLP-1 agonists mimic the activity of GLP-1s. And this medication class was initially developed for diabetes, but they also have been shown to significantly affect appetite regulation and weight loss. So they work in the brain to reduce hunger and make you feel full sooner. And it also slows down how fast the stomach empties, which also affects the appetite. And over time, this leads to reduced calorie intake and meaningful weight loss. And on average, people see about a 15 to 20% weight loss with these types of medication. Two well-known medications in this class are semaglutide. There are two brand names of semaglutide, but they're the same thing. So Wegovy is semaglutide that is approved for weight loss. So Wegovy, weight loss. And Ozempic is the brand name of semaglutide that's approved for diabetes. Even though they're the same thing, it's important to distinguish what your doctor is prescribing and for what reason, because that's what insurance is looking at. Zepbound and Mounjaro are both brands of tirzepatide. Tirzepatide is a GLP-1 agonist plus another stomach hormone called GIP, and Zepbound is approved for weight loss, and Mounjaro is approved for diabetes. And lastly, liraglutide is also a medication. It's a GLP-1 agonist. Saxenda is the brand approved for weight loss, and Victoza is the brand that is approved for diabetes. Now, what's the difference? Wegovy and Ozempic are a weekly injectable, and it's just semaglutide. It's just a GLP-1 agonist. Zepbound and Mounjaro are also once weekly injectable, 2-in-1. It's a GLP-1 agonist and a GIP. And Saxenda and Victoza, these are daily injectables, and it's just a GLP-1 agonist. All of these have been shown to help people lose a substantial amount of weight. Zepbound and Mounjaro have the highest weight loss at over 22%. And for people with obesity-related respiratory issues like sleep apnea, weight loss from GLP-1 agonists can help improve breathing and reduce symptoms. But as with all medications, there are safety and side effects to note. These anti-obesity medications in general are approved for adults with a BMI of 30 or higher, or a BMI of 27 and higher, but there are other weight-related health conditions such as diabetes and hypertension. Obesity is a chronic disease, so we expect that these medications are taken long-term. It's not something that you can stop once you lose all the weight, because people who stop, what we expect is that the weight will slowly regain over time. And there are significant side effects. So a lot of people note nausea, vomiting, general stomach upset, and that is something that needs to be monitored over time. And it's not allowed in folks who are pregnant for all the anti-obesity medications. Those with a type of thyroid cancer called medullary thyroid cancer, or if there's a family history of it, and a hormone disease called multiple endocrine neoplasia type 2. And there's a theoretical risk of pancreatitis or inflammation in the pancreas, but that hasn't really been seen in the larger trials, but it is possibly there. To wrap up, obesity significantly impacts respiratory health in addition to other medical conditions. Lifestyle changes are always going to be important, but there are newer medications like GLP-1 agonists that can offer significant improvement for people who need help losing weight and managing their obesity-related conditions.
GLP-1 agonist, if there's anything we foresee in terms of insurance coverage for them.
They are very effective. Unfortunately, they are very expensive, and it's not something that insurance companies are excited to cover. There are a lot of policy advocates out there to try and get Medicare to cover weight-related medications, but that's very much in the beginning stages. But I think that because the evidence for these medications are strong and it can be well tolerated, but I know a lot of people who the nausea and vomiting are very much issues, but it would have to be something on the political end, like where the government would try to negotiate with these companies to try and get a reduced rate. Medicaid in New York does not cover weight-related medications, and Medicare does not. Some private insurances will. There are good RX coupons that you can use, but it brings the medication from $1,600, $1,700 to $1,300, which is a month. And then the medication pharmaceutical companies, so for Wegovy, that's Novo Nordisk. For Zepbound, that's Eli Lilly. If you go on their website, there is a way that you can apply to get a discount rate. So instead of $1,600, $1,700, it would be $500 a month. It's a discount, but that's still quite
prohibitive for some people.
And then unfortunately, as a clinician, where I'm at right now is just I have to wait until someone gets diabetes for it to get covered. It's really awful and ridiculous. We should be treating folks and preventing them from getting these related complications down the line.
That is frustrating from a provider stand as well.
In spring of last year, got FDA approval for reducing cardiovascular disease risk. So it reduces the chance of getting a heart attack or stroke for those who have heart disease already. So it is now used for that indication. There are GLP-1 agonists, but there are also other anti-obesity medications out there. Aside from these, I just didn't talk about them. So just because one may not be able to get access to these, there are other medications that you can talk with your doctor.
Don't be inhibited in having that conversation just because these might be out of range for something you can afford.
I just wanted to bring up there is a fair amount of stigma still associated with obesity, which is quite unfortunate. I think just tying it back to it's a health issue, it's a chronic disease that needs to be treated as any other chronic disease, and that's always going to be through lifestyle and through biology. It's not just a matter of willpower.
One of the stigmas that doesn't go away very easily, so it's good for us to keep talking about that.